Sultanate of Oman, as usual, worked very hard to build a very good healthcare system that is responsive to the needs of population. The family is the center of development in any aspect in the government of Oman. Now, when we talk about healthcare system, it took care of all the aspects of health. A lot of health programs have been built and supported and then expanded. One of them is family health. To strengthen family health program, midwifery services initiated from the beginning. And it was thought at that point of time that those midwives have to be Omanis, so they understand the culture, they understand the needs of women in Oman, keeping in mind the cultural sensitivity, the language barriers, all the things related to health in general and family on the other hand. For that purpose, the Ministry of Health initiated a very good and strong midwifery program that started very small and now it expanded widely in the country. And we see midwives, Omani midwives, are available in healthcare settings, either in hospitals or in healthcare centers, in villages, in wilayats or districts, everywhere, and they provide a very good midwifery services to those women, pregnant women or women in labor or postnatal, and people are very happy of that service, and they appreciate having an Omani midwife with them. The role of midwives is very difficult. It demands a lot of physical, psychological, mental, emotional attention that is available all the time. For us, it is very important that you provide a positive practice environment for midwife, supported by good policies and procedures, supported by good continuous professional education programs, to make sure that the midwife is up to date, the midwife is available, the midwife is ready to provide that service whenever she is needed. The community demands Omani midwives. They talk very high about Omani midwives because they feel the difference of service they provide compared to non-Omanis, especially when I talk about the cultural congruency care, I talk about the language barriers between non-Omani midwife and the Omani lady, and many other things that told the community that the Omani midwife can make a better and a different service for Omani women. Omani midwives are very initiative. They are very available and recognizing the importance of raising awareness to the community about their role and how important it is, and how can community understand about their contribution they make to improve the healthcare services in the country. For this purpose, there are so many activities that are done at professional level and at community level. And in the Health Vision 2050, there is strategic direction to support midwives. There will be some midwives who sent abroad to continue their education and become midwife practitioners. The positive practice environment to ensure that good midwives are retained in the service and they are recognized, and there is continuity, and they are supported by everything to make them able to provide that independent and autonomous service. So the future is carrying a lot of good news to midwives, and this is what Oman is doing to ensure that Omani midwives are able to provide very competent healthcare services to those in need by supporting their education, supporting their professional status, and retaining them.